Madam Speaker, today I rise to honor a former volunteer firefighter who was at Ground Zero on 9/11, Michael Weinstock. He was an assistant district attorney in Brooklyn Special Victims Bureau and a volunteer firefighter and an EMT. On the morning of 9/11, Michael witnessed the black smoke billowing out of the World Trade Center, and without thought, he voluntarily rode with first responders to help in any way he could. Michael had been unloading medical equipment out of an ambulance when the South Tower crumbled and nearly crushed Michael to death. Today, Michael suffers from a painful and incurable disease, neuropathy. Michael has been a strong advocate for neuropathy to be covered by the World Trade Center Health Program. Neuropathy is a medical condition that results in damage to the nerves outside the brain and spinal cord. Those who suffer from neuropathy experience weakness, numbness, which typically occurs in hands or feet. This can be incredibly painful and debilitating, and many are unable to live normal lives. This is also known as the suicide disease due to limited effective treatments and that there is no cure. Studies have linked neuropathy with the 9/11 dust, a study that was published by the International Journal of Environmental Research and Public Health. The data from the 2019 study found that nearly 10,000 firefighters and emergency medical workers were exposed to toxins at the World Trade Center. The World Trade Center Health Program covered conditions categories include acute traumatic injuries, airways and digestive disorders, cancers, mental health conditions, to name a few. In 2016, the World Trade Center Health Program was petitioned to add peripheral neuropathy to its list of covered conditions, which it declined to do. In 2017, the FDNY responder again petitioned the program to add peripheral neuropathy to its covered conditions list. Unfortunately, the World Trade Center Health Program declined to update its list a second time, citing insufficient evidence. Michael's story is one of many that have yet to be told to a wider audience. This issue goes beyond the political pale of Republicans versus Democrat. As a member of the 118th Congress, I would like to use this opportunity to raise awareness of what the men and women who suffer from this debilitating disease due to the exposure of the toxins from the World Trade Center. Since the World Trade Center Health Program does not cover neuropathy, people like Michael must pay out of pocket for treatment, medications, and other medical needs. I ask my colleagues that we work together and find a solution and have conditions such as neuropathy be covered under the World Trade Center Program Act. Tomorrow, I'm proud to have Michael as my guest for the State of the Union address, and I'm proud to be his member as he is a constituent of the 3rd Congressional District. Thank you, Madam Speaker. I yield back.